Which vitamin is being tested as a new treatment for drug addiction, and does it work? So, as a drug scientist who lives in one of the cloudiest states in the United States, thanks Michigan, I was very curious about this idea that vitamin D might be linked to drug abuse. And so I looked into it and then went down a rabbit hole of deficiencies and like the French and all of these different recommendations. So, let me sum up what I found so that you can understand the science too. So like, when you've been in a relationship for a long time and you like hear that other person's pet peeves and they start to become their own, this is what is true for vitamin D. So my husband genuinely despises when people say that they'll go out in the sun and get vitamin D, because that's not exactly how it works. Now, vitamin D is a natural vitamin that basically our body produces. And that is sparked by the sun. So the UVB rays will actually start the process that leads to the kind of creation of vitamin D. Like, the sun is just not directly transmitting vitamin D to you. So please don't say that for my husband's sake. Now, vitamin D for humans is incredibly important for things like bone health and immunity, and is not actually found in that many foods. So in a lot of cases, we actually fortify our foods with it. So things like milk, including things like almond milk, which I think should be called almond juice. I'm not entirely sure. But also things like orange juice. And you can also just put mushrooms under sunlight and they will boost their vitamin D production. And then you can eat those mushrooms and that will help fortify your vitamin D as well. Now, for some reason, that feels disturbing to me, but if you want to grow your own vitamin D by putting your mushrooms in the sun, feel free to go for it. Now, there is an entire controversy going on about how much vitamin D we should actually get. Like, the recommendations differ, and that's going to be one of the major problems in this discussion, is that, like, we don't have good recommendations. So there are scientists that are basically like, yeah, the amount of people who are deficient in vitamin D is like a public health problem. But then there are like health recommendations from various countries that have incredibly different levels. And you hear scary statistics like over 1 billion people have vitamin D deficiencies, but what does it mean to have a deficiency? Like, it is defined differently in different scientific papers. And then you have the problem that certain people are far more likely to have vitamin D deficiencies. So for example, infants, people who are older, people who have darker skin, people who don't go out in the sun as often, or maybe are covered when they go out in the sun, and people with like celiacs and Crohn's disease are more likely to have low levels of vitamin D. So people with low levels of vitamin D are far more likely to have depression and dementia and especially schizophrenia. But what about substance use disorders? So most of the research on this has been done on things like alcohol and opioids. And what we see is that in quite a few of the studies, people with low levels of vitamin D are more likely to have substance abuse problems. So specifically, they're more likely to be diagnosed and they typically have a more kind of severe course of addiction. But there are also studies that show that there is like no difference in vitamin D levels between people who have an addiction and people do not. And there is even a study in Iceland that says that the lower the vitamin D levels, the less somebody drinks. So the exact opposite of what you'd expect if vitamin D is supposed to be linked to a decrease in drug use. And then you get these like one-off studies saying things like, oh yeah, we see that vitamin D actually might help with things like dopamine production. So it could actually be protective against like the neurotoxic effects of things like crystal. But what is like the overall picture here? Like, what is happening with vitamin D and drug use? And the problem is that we don't really know, because most of these studies are terrible. And I'm not saying terrible in the way that like the scientists are bad, but like we don't have a really good way of studying this. So first, what is considered deficient? As I mentioned, there's not really a standard. So in some of the studies, it says that like people are deficient, and so that deficiency is linked to drug use. But if that study took place in another country, so if it transitioned from like France to the United States, we wouldn't consider that person deficient in vitamin D. And it also depends on like the age of the study. So was the study done before the recommendations were changed, or was the study done after the recommendations were changed? And then you have the joyous new problem of, are those recommendations based in science, which a lot of the new CDC guidelines are unfortunately not. And then you have the added joy in that sometimes the actual measurements for these things are different. So are you looking at the metabolite, for example? How are you actually studying this in blood? Are we using micrograms or nanograms, or are you looking at international units? And that's just measuring vitamin D. What happens when you attempt to measure alcohol? What is considered too much alcohol? Again, that depends on the country too. And finally, one of our favorite problems as scientists, confounds. And this is a huge one for this type of research. So what we see is that things like low levels of vitamin D, as I mentioned, are linked to depressive episodes and linked to episodes of psychosis. And those things are linked to an increase in drug taking too. So is it the low level of vitamin D that's actually causing the increase in drug taking? Or is it that depressive symptom that's caused by the low level of vitamin D that is then leading to the increased likelihood of using drugs? And that's assuming that we actually know that low levels of vitamin D are causing depression, which is still not an official thing in science. And this is a huge problem. In the recent meta-analysis, they were like, yeah, what we see is that low levels of vitamin D are linked to drug use, but it could be because low levels of vitamin D are linked to things like impulsivity, and impulsivity is linked to drug use. And we need to do those studies. We need to do proper randomized controlled trials because there are none out there right now, but we're not. And then a recent study said that, like, how do we even do randomized controlled trials with like supplementation of a vitamin instead of just giving this new drug that somebody hasn't taken before? They don't even have a great method of doing this in the first place. So should you go out and buy a vitamin D supplement to try to prevent drug use and to maybe quit the drug that you're on? We are definitely not at the point of being able to recommend that right now. And side note, I would never be able to recommend that because I am a PhD, not an MD, so don't ever listen to me for med advice. And in general, y'all know I have thoughts on supplements. We don't have good regulation of supplements right now, so even going out and buying the vitamin D that's in your store, no guarantee that it's actually vitamin D in that supplement. And not things like heavy metals, which have also been commonly shown to be in your supplements too. And then to add to the seriously don't just go out and buy vitamin D thinking that it's going to help, you have this problem of too much vitamin D is also a thing. So it can cause things like hypercalcemia, so too much calcium in your blood, which can cause a whole bunch of issues. There's a good level, like the Goldilocks level that you want to be between, but the problem is that every day we're taking multivitamins, which might have vitamin D. You might be drinking fortified milk. You might be drinking fortified OJ. All of these things are adding to the level of vitamin D, and if you go above a certain level, it can be problematic. So if you don't know which, if any, vitamins and supplements you should be taking, go to your doctor and talk to them about it. Don't just find a study and say like, hey, vitamin D might prevent me from using blow, so I'm definitely going to start taking that now, because we don't have the science yet. And we're probably not gonna anytime soon.